So here we are with our patient. We're going to show you how to put the harnesses on. I'm going to take our small size pelvic harness. I draw both straps pads together by pulling. The barrel lock is right here by the belt loop. I hold with one hand, I swing around, and we just place it over the iliac crest. Then I take the belt, put it through the barrel lock, just enough to let it sit on the pelvis. That's fine. Then we'll take our thoracic strapping with the straight side parallel to the floor. The angulated side goes on the top. Once again, I just pull my belt so that both pads come together. I reach with one hand. I set this up under the rib cage and put my barrel lock, my belt through the barrel lock. Now I take my posterior straps, I bring them over the front, and that is how we set up our lumbar belts to put the patient on the table. To go onto the table, the patient will hold the pad. I will grab these straps out of the way. They'll climb up, they'll sit, and swing forward like getting into the car. And then we're ready for the next portion, which is setting this harness up onto the machine for treatment. Okay, so now we're going to, from the stage of putting the harnesses onto the patient, we're now going to show you how we put the patient onto the antalgic trak and how we put the harness straps into the seat belt buckles and setting up a treatment. I have the patient first hold their hand on these two posterior thoracic straps. We don't want them to sit on them. Then they take their hand and hold on to the pad of the table. I will reach back and grab any straps that they might sit on. They'll step up on the platform and then down onto the seat and swing forward as if they're getting into the car. At this point, I'm going to raise the seat bottom to its maximum height, because when we do our decompression, the decompression is accomplished by the seat bottom pulling down away from the patient's thorax. This up and down is how we create the decompression. So the first thing I'll do is move up the seat. I'll use a manual button on our touch screen. Once it reaches the full height, I will begin to recline the antalgic trak. I personally like to treat with the head fairly even with the level of the knees. So here we see the head height pretty much even with the knees, and modified slightly. Then I come over and we're going to take the posterior straps and put them into the posterior buckle. Take the anterior strap into the anterior buckle. We take the lateral pelvic strap into the seat bottom buckle, and the posterior pelvic strap we put into the buckle. One thing to note is we never tighten the posterior buckle. In some larger patients or the obese patient, their tissue will rest against that slack in that strap, but you never want to tighten these or you'll wind up pulling the pad off the patient. The ones that we make very snug is the lateral pelvic belt. So the first thing, now that this is all set up for tightening the belts, I'm going to pull the pelvic strap when it feels snug. Then I'm going to draw the lateral strap downward. I want to pull the patient's backside down onto the seat bottom. I'd say the most important part of the pelvic setup is making sure that the patient's bottom is right up against the cushion. If there's a gap here, then the decompression will not be as accurate. After we do that, we're going to tighten the thoracic belt under the rib cage. Once it's snug, I go and I secure the posterior straps. I pull them, and then I pull them through the self-locking buckle, and I just take the slack out of the top ones. The posterior straps here are very snug, and the side straps on the pelvic belt is very snug. This is kind of slacky, so that when the decompression pulls, this pad will kind of move a little this way to follow the angle of the rib. It's more comfortable for the patient.